The debate, the member for Huron-Bruce.
Thank you very much, Mr. Speaker. It is indeed a good day in the House as we debate and thrust our support behind Bill 41. And I thank the member from Cambridge for bringing it forward. And I also thank the members of the Ontario Lung Association for being here today. I salute you. Yeah, and I think it's so moving hearing everyone's personal stories as to why an action plan and focus on one of the most important things that we can do, support easy breathing, and stand united, stand as breathers united, to make a difference with people or for people who have been so challenged. We've heard about COPD, we've heard about asthma, cystic fibrosis, IPF, and it just makes me think of so many people that I stand on, and I stand on their shoulders. That's how I want to say that. I think of a good friend of mine. We've been together for decades, and she's dealt with asthma, and from time to time things will trigger her asthma, and she's got to rush to the local hospital for Ventolin treatments. And I know that scared look that the member of Cambridge referred to, but the other side of the coin is I also stayed behind to care for their kids. As she and her husband went to the hospital, how it affects everyone. And when the kids don't understand, what is happening to their mom when she can't breathe, that's something you don't forget either. And then we talk about cystic fibrosis. And again, we stand on shoulders of people that work so hard to try and make a difference, Speaker. And I think of our local Kinsman Club. The Teeswater Kinsmen and the Lucknow Kinsmen, they worked so hard to raise money for cystic fibrosis, and I salute them too. And in fact, all Kinsman clubs across the province. And in terms of IPF, I was thrilled this past summer to see action on this finally, once and for all. I've been reading petitions in for months upon months in terms of getting some action on consideration of the drug known as Esbriet for people suffering from IPF. And I think about Barb, one of the champions that have been to Queen's Park time and time again. She's just a wonderful soul. And we stand on her shoulders today as we look forward and put our support behind something that's been long needed in Ontario. And in terms of IPF, I think about those petitions I read in, and I couldn't help but recognize so many names that stood behind specifically a family and a gentleman from Mildmay, Hugh Detzler. He was a poster child for the need of Esbriet in this province. And so I was very, very quick to respond in late August on Twitter, and it went around like wildfire, that considerations for qualified sufferers of IPF would now be given in Ontario for the drug Esbriet. That too was a good day. And yesterday we have to recognize that it was World COPD Day. And yes, I did my bit. I'm looking at the member from Burlington as well. I hope your results were as good as mine, and the member from Kingston and the Islands. It was a very, very good exercise. And I learned something, though, in going to the Women's College Hospital yesterday morning. Women at the age of 40 need to think about being tested earlier, because it may not be as diagnosed easily, and it hits them a little bit earlier as well. And the older you get, those symptoms may be confused with other things, the way it was shared with me yesterday. So I think what I realized yesterday is my dad was right. You need to be proactive about your health. And taking this test didn't last more than 5 minutes. And the people that facilitate the tests care so much, and they make you at ease, and they make it easy for you to want to be proactive. And that's a message that's really important here as well, as we think about the type of action plan and framework that goes around the support that this bill requires. And I'd be remiss, as you all may know, not to touch a little bit more on COPD. As I mentioned earlier, the one thing I learned from my dad is you have to be proactive about your health. And a couple of years ago, the last photo I had with Dad, darn it, thought I was going to make it through, was a Breathers United t-shirt. We were holding it up, and we were saluting everyone that was working so hard to make sure that people understand what it's like to have difficulty breathing. COPD is a nasty, nasty disease, but Dad surpassed his life expectancy by 7 years because he chose to be proactive. He learned to live with it, live with COPD specifically, for 12 years. And that's, again, because he was proactive. He sought out support groups that were proactive. And his legacy is extended today through the actions that we're taking in supporting Bill 141, or pardon me, Bill 41, excuse me about that. And again, I just want to go over the importance of this, because this act will allow individuals and groups from across the province to voice their important stories and insight in living with lung disease. And without further ado, I'd like to share the rest of the time with my colleague from Prince Edward Hastings, because he knows firsthand how important this is. Thank you, Speaker.
Thank you. Further